Good evening. Good to see you. What have we learnt up to now?
Smart. It is indeed what many would call a Black Tuesday for the Magohas. This stemming from the fact that it is now in public domain that apart from the demise, apart from the tragedy that has struck this evening, the family was already mourning, and they had 5 days to go before laying to rest one of Magoha's brother, the late Professor Richard Magoha. And therefore, this particular tragedy again makes it more heavy for the Magohas, because already they were about 2 months after losing one of their family members, a journey that has taken long, only for the body to arrive this morning in the country. And we understand that the body was taken to the Aga Khan hospital mortuary, and therefore it is just few hours after receiving the body of their late kin, that is Professor Magoha's brother, Professor Richard. And then a few hours later, now the family again has been thrown into mourning. They've been plunged into what you will say another pitch of darkness, and now this evening they are mourning two brothers, two professors, one that was in Kenya and another one that was in the United States of America, Texas to be specific. That this particular brother that is now dead a few hours was at the center of preparing the send-off of his brother, and now he's part of again the tragedy that the entire Magoha family now has on their hands. The doctors that were here that are still here digesting the demise. We spoke to one of the doctors who said that he had been on the operating table for the last straight 5 hours, and immediately he came out of the theater, he got news that his colleague, Professor Magoha, is no more. Dr. once again, sorry for the demise of your colleague in the profession. If you could just again try to explain to us the circumstances for the benefit of the viewers that are joining us now, that he suffered, he collapsed 4 times between 3 p.m. and 5 p.m. What can necessitate such?
There are so many possibilities, but one thing that stands out is a possibility of a heart attack. A heart attack can occur without warning, very suddenly, and get worse as a function of time. And if help is not forthcoming, one is unlikely to survive. But if help is forthcoming in terms of resuscitation, in terms of giving oxygen and medical drugs and supportive measures, somebody is likely to survive that heart attack and live to see another day. But a heart attack that occurs outside the medical support systems, one is likely, the victim is unlikely to survive. Yeah, and it depends also on the magnitude. It may come to a small, occur to a small extent and then just worsen with time. So it could be recurrent, or it could be massively fatal and take away the victim, or occur in paroxysms and occur repeatedly until the victim succumbs.
How did you receive the news of that Professor is no more?
I received the news with shock. I was in the operating room, actually to the tail end of the operation. And I was shocked because I thought that the person who was breaking the news was confusing this demise of Professor with the demise of his brother. And I did not believe it, because I thought it was just so soon. It happened just the other day, and I thought they were talking about the brother who passed away a few days ago. So I left the operating room and headed straight to Lee Funeral to try and come to terms and confirm whether it is true that indeed the great professor had left us. So I received this information with shock and disbelief as well.
Thank you for your kind words to the family. As a union, Deputy Secretary General of the doctors in the country, have you had the opportunity to talk to the family members, maybe just to try and find out what could have, what transpired really? Because it is within a very short period of time that the tragedy struck.
Thank you very much. And on behalf of the union and on behalf of the General Secretary, Dr. Davji, I want to first of all pass my deep condolences to the family, Dr. Barbara, who is one of our members, and the son, Dr. Michael, who is one of us. And we are really, really in shock. We still can't believe that Prof is gone, because Prof has been a great mentor, a great teacher. And from what we've heard from the family and from his dear friend, Professor Mwanda, is that Prof started feeling ill late this afternoon, and he was able to get his loved ones to come to be by his side, and his dear friend, Professor Mwanda, was also there, and he had a cardiac arrest, and they tried to save him. And I'm sure that if we had a responsive emergency response system in this country, the great man, Professor Magoha, would still be alive. And that's why, as a union, as KMPD, we keep on advocating for what Prof used to teach us. Because Prof used to talk about this mythical Kanyakini Hospital, which when he was the board chair, medical council chair, he said that he wants all hospitals, public or private, big or small, to be able to attend to anybody, VIP or not, whenever they have emergencies. As a KMPD, we have always said that we want to have a health system that is responsive to whoever will need it. And we know that Prof, wherever he is, the services that he gave to this nation, we will never forget. And I hope that as public servants, as doctors, as workers of this country, we can also just emulate the patriotism and love and sacrifice. Because what I know for sure is that even as Prof lies on that cold slab, he's gone empty. He's gone empty because he gave everything that he had to this nation. May we never forget Prof. May his soul rest in peace.
Indeed, may his soul rest in peace. In the words of Dr. Ouma Oluga, he said that Professor Magoha lived like thunder and has departed like